Greetings. In this video, we will learn about urodynamic study, which is a test in which we assess the pressure in the bladder to see whether the bladder is functioning well or not. How it works is that the bladder is artificially filled and its pressures are measured to see how well is the bladder able to store urine and how well it is able to empty the urine. So it is a test in which we are assessing the functioning of the bladder and the outflow of the bladder. This is what our urinary system looks like normally. It consists of two kidneys, two tubes attached to it, which goes to the bladder where the urine is stored. The function of the kidney is to filter out the waste product from the blood and to form urine, and then this urine then travels to the bladder where it is stored and is eventually relieved during voiding. Bladder is a special organ which is able to hold urine without increase in the pressure, as you can see here. So this bladder has the capacity to enlarge. Its elastic nature allows it to hold more and more urine without much increase in the pressure. This is important because of the high pressure. We may have very frequent urge to pass the urine, and also it may damage kidneys because this high pressure in the bladder is transmitted through these tubes to the kidneys. In this test, a catheter is inserted into the bladder to measure the pressures in the bladder, and at the same time another catheter or a tube is placed in the anal opening to record abdominal pressure. The insertion of tubes into these areas may cause discomfort to the child, but these tests are suggested after much thought by the doctor, and therefore its benefits definitely outweigh the risks. In this test, a catheter or a tube is inserted into the bladder to measure pressure and to fill bladder with water or contrast material. And at the same time, another tube is placed in the anal opening to record the pressure in the belly of the child. After this part of the study, the child is then asked to pass urine in a special container to see the amount of urine the child has been able to pass and how quickly the bladder is emptied. In the next few slides, we will talk about how to prepare the child for this investigation. The first way is to ensure that the child has no active urine infection. Depending upon the protocol of the institute, one may be asked to do a urine test to confirm that there is no active urine infection before the investigation. However, just to mention, clinically, the symptoms of urine infection are passage of foul-smelling urine, dirty urine, or having a fever without any particular cause. So in such children, it is important that there is no active urine infection, because if the investigation is performed with the urine infection, it can deteriorate the child's condition. Antibiotics will be recommended by the doctor to prevent any infection. The child should come in loose clothes which are easily removable, and also with a comfort object or item that the child feels comforted by, so that he or she can feel calmer during the investigation. The child before the study should have passed motion before coming to the hospital because a tube is inserted into the anal opening. For this, it is important that that area should be clean. Now let's try and understand the problems that can happen after the investigation. One of those problems include burning sensation. After the investigation, the child might complain of stinging or burning sensation while peeing the first few times after the test. In that case, drinking extra fluids can be very helpful. If, after the procedure, there are any symptoms of urine infection, you should seek help and visit your doctor to treat urine infection as soon as possible. Again, you must drink a lot of water, and the doctor may also give you antibiotics for that. If this problem persists, or the child is facing some other health problem after the procedure, you must visit your doctor. Thank you for watching the video.